Welcome to Neogenesis Nutrition, your place for a new beginning, where health is not just a destination, but a profound and transformative odyssey. Hello, I'm Dr. Jennifer Champion, Doctor of Clinical Nutrition, board-certified hypnotherapist, author, and a general badass. With a relentless dedication to challenging the status quo and pushing the boundaries of conventional medical wisdom, I have earned a reputation as a fearless pioneer in the functional nutrition world. Developed out of grief and armed with a deep-rooted passion for uncovering the underlying causes of disease and dysfunction, I embarked on a journey of discovery that led me far beyond the confines of traditional medical and nutrition education. I refused to accept the limitations of mainstream approaches and instead delved into the realms of alternative therapies, functional medicine, and cutting-edge nutritional science. All right, well, welcome back. This is Dr. Jennifer Champion with the Neogenesis Nutrition Podcast. Today we have dual Dr. Jordan Graeme-Weingard with us, and she is a chiropractor and also a doctor of clinical nutrition like myself. We've been friends for about half a lifetime, it feels like at this point. And I was really excited to bring her on because she has, a wealth of knowledge when it comes to pain. I always tease her about putting people in pain and getting them right back out, kind of job security. So, so Jordan, why don't you tell all the listeners who you are? I already introduced your name, but go ahead and tell them who you are, what you do, and how you got into that field.
Well, I'm Dr. Jordan Graeme-Weingard. I have a doctorate in chiropractic medicine, a master's in functional medicine and nutrition, a doctorate in clinical nutrition. As you stated, I also did a fellowship in integrative medicine. And to add more to my plate, in the process of a MBA program with a health care administration emphasis. As far as my role in chiropractic, I kind of just fell into it. I really had, I had friends that went to a chiropractor in high school here and there they had migraines, I think, but I really never knew what they did or what kind of education they had. And fast forward, I was a Division I athlete in college and ended up having shoulder surgery. And a friend of mine, who is now my husband, called and asked how I was recovering and, how school was and if I was going to get back to throwing with the team the next season. And he just happened to ask me how school was. And I go, dude, I'm kind of freaking out. I, thought I was going to go pre-med and undergrad and then go to physical therapy school. And I'm spending a lot of time in PT right now with my shoulder, and I just don't think it's a great fit for me. And he's like, well, what about chiropractic? I was like, nah, buddy, I'm good. And he's just like, well, I'm in chiropractic school right now. I know you. I think it might be a good fit. He's like, do you know what they do? And I go, don't know, don't care. And he's like, well, how about you just look into it for me and I'll call you in a few weeks. And I'm like, all right, whatever. And then I was like, he'll call me, and I'm a terrible liar, so I might as well just look into it, scratch it off my list, and then move on. And literally the next day I was in a physical therapy session, and my PT, who I had a great relationship with, was asking me about school and what I wanted to do. I was like, dude, my friend said I should be a chiropractor. He's like, yeah, you should look into it. And I'm like, really? And he's like, yeah, I know a great chiropractor. Her name's Kelly Pearson. She's the Spokane Valley. She works with Gonzaga athletes. She works with the Spokane Shock, which is the arena football team. She worked with the Spokane Chiefs, which was the hockey team at the time. He's like, you're an athlete. I think it'd be right up your alley. I'm like, all right, well, maybe there's something to this. And so I called Kelly. I was like, I have no idea what you do. And fortuitously, what is it called? Your advisor, your academic advisor, said he'd give me 5 elective credits if I did a internship. So she let me do a summer internship with her, and the rest is kind of history.
Wow. And so you've been in the field for how long?
This will be 13 years of practice.
Wow. That's pretty amazing considering you just kind of stumbled into it.
The story of
And
my
the
life.
right. Well, and the defiance doesn't really surprise me too much about
Yeah.
the don't know, don't care. Um, I was very much like that when it came to nutrition, ironically. Like, yeah, whatever. They always tell me food doesn't matter. So when I go to the doctor, so why would I even look into that? So
Yeah.
I can relate to that for sure. So tell me a little bit about an experience that you've had with a patient, obviously leaving out patient details, but was there a specific patient, maybe recently or even further back in the past, where you felt like you made such a huge impact for them with chiropractic care?
Uh, I, uh, as you probably feel too, a lot of the times you can help thousands of people, but it's the people that you can't help that usually stand out the most to you.
Mhm.
However, my recent situation, so I've been in a hospital-based setting for the past 10 years, and they've decided to no longer pursue integrative therapies. And so I have a patient that was very upset by this. One, she has conditions that it's more of an ADA access for her. She has to take ride to cares. She's um, uh, has cerebral palsy, so her access to things isn't very easy. And I didn't I don't do a lot of work with her as far as nutrition goes, but for chiropractic, I do a lot of flexion distraction, I do a lot of soft tissue work, and I do some manual adjustments with her. And to me, I didn't realize the impact that I had on her until she got her letter saying we were no longer going to be there. And she's like, between you and physical therapy, you're the reason I don't have to wear my braces and I could walk.
Wow.
Um, so that was pretty impactful.
Yeah, absolutely. I know that, we as practitioners, sometimes we get into the I do this, then this happens, kind of
Yeah,
sequential processing that we learn during our training, whether it's in chiropractic or PT or primary care or even nutrition. We just kind
just
of
to
start looking at these, almost robotic situations because we've done it so many times.
just to be protocol, right? Like, okay,
Yeah,
this
it's a standard of
you're
care.
which it's not. It's never black
Mhm.
or white. It's always this vague area of gray where
Yeah.
um and being in chronic pain uh clinic, I mean, I would say 90% of my patients are chronic pain. Um, and so when I first started there, one of the psychologists put it really well for me, helped me out quite a bit because, you know, 13 years of practice, 10 being with chronic pain and in a hospital setting, I really didn't have a whole lot of experience with chronic pain before I started there. And so I was getting really frustrated with myself. Like, these
Mhm.
patients keep coming back and I'm not making that big of a difference. And their pain is always a six. And he put it in a really good, he's like, obviously you're doing something for them, whether it's just putting your hands on them or listening to them, because they're getting benefit from you to help them with their quality of life. Their pain may always be a six, but how are you affecting them in the other areas that they can improve that quality of life? So it's like, oh, okay. So after that, I kind of went away from what's your pain level at? Are you 0 to 10? So
Sure, sure. And some of those questions almost seem somewhat platitudinous when we're working with somebody and chronic pain touches all the areas of life. We see more mental health struggles in those who have chronic pain and vice versa.
yeah,
And to see, the amount of heart that you put in and to hear, well, yeah, I'm at a 6. Next week, I'm at a 6. Next week, I'm at a 6. Yeah, maybe they're not going to a 5, but they're not going to a 7
Yeah.
either, right? They're holding steady and they know that you're there to support them, to listen to
Mhm.
them. And, I truly believe, and I think that this is a little bit kind of maybe out there in terms of traditional medical thinking, but that chronic pain can also be a manifestation of emotional pain, mental pain that is unresolved, and it starts to manifest within the physical body. And just you being there, Jordan, to put your hands on them, maybe when nobody else has done it in a therapeutic capacity all the way back to their childhood. No, maybe nobody gave them hugs, nobody showed them the
Yeah.
love that they deserved as human beings. And I can see just in your responses how much you truly care for the patients that you're working with. And I mean, I think that's such a beautiful thing to have a provider who cares that deeply for us when we're struggling or we need
Yeah.
some help.
And I don't think it's out there for you to say it. I mean, even the definition of pain itself is a physical and emotional response to a stimuli. And, you can't have one without the other. You can't fix the physical pain without addressing the mental or the emotional component to it. So, and it's just even looking or taking the small example of you being nervous, right? When people are nervous or they're stage fright, what? They get butterflies, they get stomach aches. That's a
Mhm.
physical response to an emotional stimuli. So you can't discount the mind in any sort of pain scenario.
Sure. Absolutely. Absolutely. Can we back up just a little bit? I know the concept of chronic or chronic pain gets tossed around. I've seen it a lot on social media. I've seen it a lot in different webinars and seminars and things like that. Can you take a moment and help us differentiate between what chronic pain is and acute pain?
And the simplest terms, anything that is greater than 3 months is considered chronic.
Okay. Okay. Perfect. Yeah. So, you might be in a car accident on day one
Yeah,
and feel some pain, and that in that moment that is acute, but if it continues on beyond that 3 months, right, we're dealing with that chronic pain. So
yeah.
yeah, absolutely. Thank you. um what what role do you see, or what role have you seen chiropractic care playing in the management of chronic pain?
I think chronic pain in and of itself is a subset of medicine that most people don't like to treat. It's hard, it's frustrating, and I don't I even in my medical training don't recall a whole lot of experience with chronic pain. As chiropractors, we're really great at acute low back pain. Like that's kind of our bread and butter. Um, but I do know that there's quite a few chiropractors in hospital-based settings that both see acute and chronic pain. Um, and they all kind of practice a bit differently. So, um, in my personal experience and anecdotally with my own patients, like it's it. I'm trying to with chronic pain patients, I've seen the best care is when they're having multiple modalities working together for the patient themselves. So it's not just the pain medications, the gabapentin, the Lyrica. It's the physical therapy, it's the chiropractic, it's the acupuncture, it's the pain psychology, and all of that combined is what, in my opinion, has seemed to be most beneficial for the patient. And then the state of the patient, knowing that we're all together, working together too, gives them some sort of stability that they're being taken care of as well. So I don't know how to judge that aspect of the patients besides just asking them.
Sure. Yeah.
Um, but it has been a common comment that I feel so good I could come to this pain center and you guys, I know you're all working together with me for me.
Yeah.
And we do have meetings as a clinic where we address more complex cases. And patients know we have these meetings, and we're like, oh, will you get me on your meeting next time? Will you talk about me? So they know. Which is kind of funny that you're like, oh, you're competing to be in this meeting. Are you sure you want to be one of those things?
Do you know what this
No.
meeting is about?
So, oh, and we have naturopathic medicine, and she thinks to add another complex layer, our naturopath in our clinic specializes with like connective tissue disorders, so EDS and Marfan's and POTS and dysautonomia. So that adds a whole nother component to complex pain in patients that typically nobody wants to treat those diagnoses.
Yeah, those are definitely challenging diagnoses. I know I work with them on the nutritional aspect, but you don't want me doing anything physical with anybody because it's kind of like why I left my after my first year of med school because I knew Stab Lab was coming up, and I was like, nobody's going to want to play Icy's Clothies with me during the phlebotomy class. So I think
Like,
this is where I exit stage left. But I love that you brought that whole integrative approach into the conversation because that was going to be one of my next questions is no provider can do it on their own. You know,
no,
a lot of us like to think that we can, that we're the end all be all, especially some of the different branches of medicine. But when we actually can set our own egos aside and we realize I'm here for the patient, I am actually employed by this patient to help them. They are essentially the CEO of their own life, their own healthcare. We're all just kind of worker bees for them. So I love that you're really focusing in on that integrative because that's something that we've been shifting here in this clinic instead of being just nutrition or just the functional medicine approach. We're looking at the integration and how do we come together because one approach isn't going to work for every single person. And it sounds like you guys have really, you in particular, Jordan, have really taken that to heart of what do you need? What is going to make you
yeah.
feel better in this moment? So that's
Well, it sounds
wonderful.
like you're on the right. You have the same kind of the view as I do. I mean, the patient has autonomy over themselves and to help direct their own health care. And I think some patients don't realize that they have that autonomy, that they can be like, no, I want to try acupuncture. I want to try therapy. And that's kind of where I bring it to them too. Like, you don't have to see me as a chiropractor. We have acupuncture, we have chiropractic, we have massage, we have naturopathic medicine, we have the pain specialists. And they do an assortment of trigger points and ablations and ESIs and all of those more invasive procedures. So we have options for you. Where do you want to start? This is where I would recommend you starting, but you have to meet the patient where they are and they can help direct their care. Like, I don't always like, I'm the doctor, I'm the authoritative figure, I'm going to tell you what to do. It's no, this is a team effort because when they're involved in their own healthcare, now they have some chips in the game, right? And now they're more,
Mhm.
oh, I can choose. Like, I think this is going to help me. And maybe it is something that's going to help them, or maybe it's just that, you know, mental focus that, oh, I'm in charge and I can be proactive in my own healthcare has some effect on that as well.
Yeah, yeah. I love that, that we're empowering. I mean, I'm sure that you too have seen it, the deer in the headlights look when you ask the patient, what do you think would work best for you? Or where do you want to start? And they look at you like, what just happened? Did I just enter an alternate world? And they automatically want to go into the no, just tell me what to do. Because in almost every other aspect of their healthcare, they are getting that. Take three of these. I'll see you in, 3 months. Good luck. We'll, then deal with whatever comes
Yeah.
after that. And they're just kind of being told dictatorship, style. This is how you do this,
Yeah.
So I love that you bring that in as well. Can we kind of shift over to the concept of inflammation here for a moment? Again, that's been another big buzzword lately. You got to reduce inflammation. Inflammation is the root of all evil. And while I don't disagree, it still seems kind of ambiguous to those of us who are not in the healthcare world, but we're seeking care from somebody is, and we're just like, oh, I think inflammation, I must have it. How do you assess inflammation? How does it present? And what are some of your strategies for it?
So I think inflammation is a word that people do understand. And I think when talking to a patient about inflammation, like they understand acute inflammation, it swells, blah, 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 blah. But chronic inflammation, this is why I always kind of describe it like, okay, you didn't hurt your elbow. You didn't have an injury to it. Your elbow hurts because there's some sort of inflammatory process going on. Now, when I know it's kind of widespread and systemic inflammations, because, well, your elbow hurts today, but tomorrow your right knee hurts. And then 2 days from that, your left ankle is hurting. Now your big toe hurts. Now I have a headache. And so I kind of see it's migrating. So that doesn't tell me that it's just that specific joint, that there's something widespread going on. Is kind of how I explain it to them.
Yeah.
That, and my patient population is 86% Medicaid and Medicare. So I don't typically run a lot of labs, and just because of the cost effect for the patients, and not
Sure.
usually typically able to handle an out-of-pocket expense if their insurance doesn't cover it. So a lot of the times when I'm treating that, I will do some hands-on work. Let's say it's, a chronic low back issue. I will try to find a directional preference that reduces the pain locally. And then if it's kind of a widespread, like a fibromyalgia type pain or EDS type pain, we take smaller steps. Like, okay, we live in the Pacific Northwest. We barely see the sun.
I
Side
know.
effect of vitamin D deficiency is low back pain. It causes
Mhm.
myalgias, it causes joint pain. So that's typically one that I'll be like, okay, let's just empirically start with vitamin D. I also start with a little bit of magnesium, and hydration are kind of my first like go-tos.
Mhm.
And then as they start to feel a little bit better, maybe it's just from the manual therapy that I'm doing, addressing like, okay, well, let's delve into your diet a little bit, and where do you think we can change the diet a little bit? And it's more of a slow process for me. I'm always taking it very slow,
Mhm.
um, just because I think smaller changes daily make for bigger changes over time, and especially
Yeah,
for
absolutely.
someone who is born and raised on, well, fast food is fine. It's food is food, like not me
Mhm.
particularly, but most of our population is we don't know how to eat healthy. We don't know how to go to the store and shop on a budget. There's like, we don't know how to cook for one person. Like there's so many things that we don't know how to do that we're no longer really taught. So I think making smaller changes with their diet, but also showing them symptoms that are caused by chronic inflammatory processes like brain fog and fatigue and just widespread muscle pain and GI disruption, and like just like a lot of education on these are symptoms that aren't normal. Like
Yeah.
if you had a healthy body, you should not be experiencing these symptoms, and just kind of breaking it down slowly and just slowly making small changes.
Yeah, absolutely. I know I have a lot of neurodivergent population, because I am as well. So, and I'm very open about it now. 10 years ago, new. I told everybody I was normal and they were crazy. But now I've accepted my whole new level of crazy. But in terms of my neurodivergence, especially my ADHD individuals, they come in rip roaring. I'm going to make all these changes. Give me 20 things to do. And, they're going in with the best of intentions. But over the years of practice, I'm in like, whoa, slow down. Like, let's just do one. Let's just do one thing. And I call it the SAG, the smallest achievable goal. And I'm like,
Yeah.
what's your SAG this week? And all my clients now know what that means. They're not, looking at their boobs and going, yeah, they're sagging all right. Um, they're actually looking at what can I do this week? What's going to be doable?
Yeah.
And it sounds like you're breaking that down as well for your
Yeah.
individuals, because I really think the inclination is when you're in pain, how fast can I get out of it?
Get out of it.
And, let me latch on to whatever the latest and greatest or, next theory or different possibility. is in terms of my healthcare. So I love that you slow it down for everybody because, yes, you're right. When we make small incremental changes or we habit stack along the way,
Mhm.
we really end up creating a long-term vision and new life creation of
Yeah.
how we want to live. And yeah, there really is no true education around nutrition. There's a lot of nutrition noise,
Right.
and the concept of everything in moderation, well, that doesn't work for everyone.
No.
In fact, it works for very few, especially with the way our food supply is and all of the things that are being done to it, and the nutrients that are just missing, key
Yes.
nutrients that are missing from our diets, like you said, vitamin D and magnesium. So what types of nutrition advice or modalities do you like to offer your clients? I know that or I should say patients. Yeah, because you are a paid grade or two or three ahead of me, so I can throw that in there for you. You get to use the word patients. Um,
I I call patients when I send them to you. Like I don't want to mess with the hormones. You need to see Jen. I
right.
hand your number out daily. Um,
I know it's like herding cats. Um, so what are some of your favorite food related recommendations that you find yourself dispensing quite often?
Hydration is probably my number one.
Mm.
Getting people to just hydrate themselves is so hard. I don't like water. I have to pee. Oh, it's just too much to carry around the water bottle with me.
Right.
Like number one, we need to hydrate. Only 12% of adults get their vegetable intake. Simple, adding some greens to your diet.
Hmm.
Um, when it comes, I mean, because I don't do a lot of supplements just because of the financial
Sure.
barriers that my
Budget,
patients
yeah.
tend to exhibit. I Vitamin D is one of the top, magnesium's one, um, an omega-3 are kind of my top three. And then it kind of goes in and out. I'll do a lot of berberine
Mm.
because then I could address the gut, but also with, blood sugar regulation. Um, Alpha lipoic acid is actually one that I use quite a bit, especially with my stenotic patients that have neurogenic claudication and diabetic peripheral neuropathy. That seems to be really beneficial for them. So those are kind of the supplements just off the shelf that I will reach to immediately. If someone is like wants to take a supplement that's like driven, like anti-inflammatory driven, I'll reach in and grab the turmeric and the not berberine, but bromelain. Um,
Mhm.
and I see the bottle on my shelf and I can't remember what it is.
It's all good.
I don't have my smart phrases I could type in. But yeah, those are the kind of the top things that I immediately kind of gear towards, and then as we go and they start addressing it, because those supplements in and of themselves can make such a big change. Like vitamin D, I mean, it's muscle pain, joint pain. It's great for the mucosal lining of your gut. Same with the omega-3s. Like, so I could hit multiple areas without the patient actually knowing we're hitting multiple areas. So
Yeah, more bang for the buck, whatever that
yeah,
buck is that they can,
yeah.
manage to
But
afford.
to go back to your SAG,
Hmm.
there is a study that I can't remember the details off of my head, but I could find it. That shows if you give a patient one thing or one exercise to do, they're like 80% likely to stick to that one. If you give them
Hmm.
two things, that drops to 65%, and three or more, it's like clear down to 15%. So like
Right.
adherence to just one thing. So usually I just stick to the one.
Yeah. And then you can build upon it.
Mm-hmm.
When I create a protocol for somebody, I outline the tentative roadmap. And you and I are both about the same generation, so we still know what an actual map looks like, and we can outline things. And that's kind of what we're using in terms of this is where I think we're going to go, but we're going to break it down in
Yeah.
small incremental steps so that it's not overwhelming. It feels doable. And when people are successful, they want more. It's an
Yeah.
addiction, it's a dopamine hit. I did good. But when you pile on 15 things and you didn't do any of them because they were overwhelming, you feel like you suck at life. You're not likely to continue. You're not likely to see the benefit in chiropractic or any form of integrative care. So, yeah, I think anywhere that providers can start to boil it down and just say one thing.
Yeah.
I know you're excited and I'm so happy you are, but one thing at a time.
Oh, another thing, adding protein. So many
Mhm.
people do not get adequate protein in their diet, and even the RDA is a low
Mhm.
stat to get protein. So that
Yeah.
greens, hydration, protein.
Yeah. Well, and I know that you've done multiple fitness competitions in your life. Yeah, I'm going to throw you under the bus because
Thank you.
you always look amazing. And I remember back when we were both working on our masters, and we had to go to that conference, and you and Ty, your husband, were walking around with your cooler of food, and I was like, what's wrong with the food in Portland? And I'm coming up from LA area and I'm like, anything has to be better than down in LA. But I'm seeing you, I mean, and you're like cut, toned, like on it, and you're like walking around with your food bag, like there's nothing wrong. And I'm like, she's odd. But then I was immediately fascinated by so tell me a little bit about your goals for protein, and you can use your own personal experience as well, because I want people to kind of be able to paint a picture that will help them understand how important protein is.
Well, I mean, there's different types of protein, right? Like collagen and all of those. People don't think, oh, I need collagen to help with my skin, to help with my hair. I mean, I don't
Mhm.
have any hair, but like your nails, like you
Mhm.
need collagen for that. People don't think of that as a protein. Um,
Mhm.
or your gut, helping with your
Yeah.
gut. Like everything
Mhm.
comes back to the gut for me, at least.
Sure.
Um, but when I'm telling people to increase their protein, getting at least one, I'm bad at math, so 1 gram of per kilogram of body weight, I think is what
Mhm.
the equation is. So
Mhm.
I try to get them to that, or I'll break it down. Like, can you get 20 grams in breakfast, 20 grams in lunch, 20 grams at dinner? What, depending on the patient. Some patients are just going to be like, I just want my totally daily intake. What do I need to hit?
Sure.
Some people need to break it down per meals, or like give them
Mhm.
ideas of, okay, like quinoa has a lot of protein in it per serving. Like people don't think, oh, it's a grain, it's going to have a higher content of protein. Like, so just addressing different areas where they'll be able to get a good source of protein and not being afraid of it. I think um,
Oh yeah.
red meats and eggs have been kind of demonized when actually
Oh,
they're
for
great
sure.
sources of protein and choline and all sorts of things.
Oh, absolutely. I just did a podcast. I don't know if you had a second to listen to it, with Dr. Corey Schuler, and he specializes in men's health. And he's like, I want my patients eating red meat in the morning. Like, get a good grass-fed, grass-finished
Wow.
steak. Start your day that way so that you're getting for and again, men's health. But he's focusing on you need at least 50 grams of protein in that morning in order to move the dial on your testosterone. And testosterone has pain reducing effects to it, which is why more women experience higher levels of pain than, men just typically. Experiences aside, we have more pain receptors as well on top of that as being women. But so as we get ready to kind of wrap up, I'd love for you to kind of outline a somewhat typical protocol that you might give to somebody that they could implement starting today to help address pain needs?
Number one is movement. We need to move. Our body's meant to move. What do they say? Motion is lotion. Um,
I
we
love that.
get and we get so fearful of pain that, oh, we can't do anything, when actually we hurt because we're not moving, and then we don't move, and then that causes this vicious cycle of more pain. And so we get
Mhm.
trapped in this hamster wheel. So I think number one is just movement. Um, Looking at different modalities would be to whatever fits your insurance needs or your own personal wants to try. Try chiropractic, try acupuncture, try massage therapy, try rolfing. Um, Go to a naturopath, go see Jennifer. Um, you know,
Thanks for the
all those
shameless
things.
plug.
Well, it's true. Um, uh, Trying some of those, because you want to keep your body functioning optimally. And when I talk to patients about what chiropractors do in general, it's like I am trying to help your body function and move optimally. When I put my hands on you, I'm trying to work on improving joint mobility, muscle hypertonicity, flexibility, and strength. Like those are my aims. So I think it's highly important to just keep your body moving in whatever capacity it is, whether it's walking. I'm highly allergic to running, so I don't do that. But um, I love Pilates or yoga or Tai
Mhm.
Chi. Tai Chi is a great one. And when addressing chronic pain, finding something that helps with you mentally, whether it's daily affirmations or meditation, again, Tai Chi or Qigong, um, journaling, um, speaking to somebody professionally, any of those things to help you reflect to weigh what emotions or anxieties or stresses may be contributing to that pain. Um, and just what I anecdotally see with my patients is sometimes with chronic pain, a lack of social network.
Mm.
And as humans, I think we are social animals and we need that network. We need that human contact. We need that human sounding board and that connection with other human beings. So I think it's important to find a community, whether it's just a friend, a church, a LARPing group, who knows what it is, but live action role playing. I don't know why that kind of came to my
What is LARP?
I, I was thinking of a movie and uh
Okay.
that came to my mind. I don't know why. But, but it's whatever group that makes you feel welcome and excited to be a part of. I think that's important. Um,
Sure.
I think those are kind of my roadmaps to areas of the body that I would address with treating chronic pain.
Oh, absolutely. And I do love that you brought in that social network, especially with today's environment where our quote unquote social capacity is social media, which most of us know is just a falsehood, anyways.
Yeah.
But yeah, that human connection of reaching out, having a conversation, hearing the other person laugh, or, have some sort of emotional response to the
Mhm.
things that we're saying and vice versa, really fosters that connection and can take us out of our own body for a little bit, our own thoughts, our own worries, and all of that. So, absolutely. Well, Jordan, I know that you are in a transitory kind of place right now, through no fault of your own, I will throw in there. But I also know that your husband has a very active practice in the Portland area. How would somebody get involved in chiropractic with him if they were interested in doing so?
And I'll probably be working with him a few days a week. Um,
Okay.
but he has all the same credentialing I do, and he actually works with me at the hospital on a part-time basis. Um, and so his practice is Kismet Chiropractic in Newberg, Oregon. Um, and he's been there, oh, I don't know. I'm going to be a bad wife and not know how long the clinic's been there. 6 or 7 years, 8 years, maybe. I don't know. Um,
We'll just round up.
but he has massage therapy on hand and potentially acupuncture. I know he had acupuncture at one time, and they wanted to be in downtown Portland um, because Newburgh is just south of Portland and in wine country. So,
Excellent. And
oh,
what's the phone number that they would call if they were interested in that area?
oh gosh, you're putting me on the spot remembering my husband's phone number.
I
Um,
know
uh,
back in my age, like we had to remember everybody's phone number. There was no saving it. You had to go and actually
I
punch in all the numbers.
Yeah, I'm actually really good at remembering like Ty's number, my sister's number, my mom, my dad's. Like if I'm in an emergency, I know whose number to call. But Kismet Chiropractic in Newburgh, Oregon, his phone number is 503-538-5433.
All right, perfect. Didn't mean to put you on the spot there.
Oh, no, you're totally fine.
It's like, what's your own phone number? I don't call myself, so why would I
Dude, I
know?
forgot my own address the other day. I was like, something's wrong with me. I
Oh.
need to go get a CT scan. I can't remember my address.
Gosh, that reminds me of back when my son, who's almost 17, was in kindergarten, and the kindergarten teacher, one of their benchmarks for them was that they had to memorize their address. So, for the life of my son's memory, he could not remember what his address was. So, during parent-teacher conference, I get called in, and they're like, "Your son doesn't know his address," and I'm like, "Mm-hmm." And she looked at me like with just like a shocked look on her face, like, "Do you think you should fix that?" No, because if he knows his address, he can find his way home if I drop him off in a field somewhere. And she just had this white look on her face, like, and I was like, I'm kidding. I will work on it. Oh,
Some people
anyways,
don't know how to take a joke. So,
right. Well, and I have the ability to go deadpan real quick and easy. So yeah, I can make it look like I am entirely serious and I wasn't. Anyways, well, thank you again for joining us. I
of
really
course, thank you
appreciate.
for having me.
Yeah, absolutely. And we made it through without too many snide remarks, which is a fabulous thing.
I know. I mean,
But yeah, no, I do appreciate you, telling the listeners about chronic pain and what they can do in terms of being able to manage it. And it doesn't always have to be medications. There's
yes,
a multitude of options out there, and just being open to them can open a lot of doors. So again, thank you so much.
of course. Thank you again for having me. And I'll send you a list of resources too. And I can send my social media handles for your show notes as well. So,
Okay, perfect. I'll look forward to that. And all as always, listeners, thank you so much for joining in today. And I hope that you were able to take some really good information. Hopefully, you weren't taking notes while you were driving, if you were listening to this in the car. If so, we'll know who you were. And, and have a wonderful rest of your day. And always take good care of yourself. Are you ready to embark on a journey towards a healthier, happier you? Welcome to the Neogenesis Nutrition Podcast, your ultimate guide to holistic wellness and transformative health. Our podcast isn't just another health show. It's your gateway to discovering the power of nutrition, the joy of balanced living, and the freedom of a body-positive mindset. Each episode is packed with expert interviews, practical tips, and inspiring stories that empower you to take charge of your well-being. Whether you're looking to boost your energy, overcome an eating disorder, or simply feel better in your own skin, we've got you covered. Ready to take the next step? Call us today at 253-507-5775 to schedule your initial consultation. Let's create a personalized plan that fits your unique needs and helps you achieve your health goals. Don't wait, your transformation begins now. Call 253-507-5775 or visit us on the World Wide Web at neogenesisnutrition.com to schedule your appointment. Neogenesis Nutrition Podcast, where your journey to a healthier life begins. Subscribe now and let's nourish your body and soul together.